And with that, we say good evening. I'm Jay Crawford, joining you from home tonight.
And I'm Betsy Kling here in the WKYC studios. Both Russ and Laura are off this evening. We're going to begin tonight with nursing homes. And as of today, there are more than 1,600 confirmed cases of COVID-19 at Ohio long-term care facilities. Hours after a 3 News investigation exposed inaccuracy on the state's website that tracks cases, that page was quickly removed, and then another list was released yesterday. But that data remains riddled with errors at a time when accurate information is so very key. 3 News investigator Rachel Polansky has been leading our coverage on this story.
Natalie Corriveau is part of a growing number of Ohioans suffering through the pandemic with a loved one in a nursing home.
We haven't seen her for, I guess it's been 4 weeks now.
She understands the need to isolate her grandmother, Patricia. She doesn't understand the lack of answers from health leaders.
Honestly, just want the truth of what is the real deal.
Natalie's grandmother was diagnosed with COVID-19 over the weekend, and Natalie's been relying on 3 News to keep her informed because of the inaccuracies on the DOH website.
You were able to find at least 5 cases at the one specific facility my grandmother was at, and the state website doesn't even have any facilities in the county.
Natalie's right. While the Toledo-Lucas County Health Department reported 24 facilities with active COVID-19 cases, none were listed on the state's website until this afternoon. I took these findings to the Ohio Department of Health. For family members, they want a comprehensive picture. Why isn't the state providing that?
The reason is because we didn't have an accurate way to collect that information from the local health department.
Spokeswoman Melanie Amato admits there have been reporting discrepancies. She says prior to April 15th, counties did not have a uniform way to collect and report COVID-19 cases. Now she says they do.
And so the bugs and the kinks for the local health departments to report this information need to be worked out, and we understand that.
I continued to press her on the public's desire for more information. What about recoveries and what about deaths? That's something else that a lot of people want to see.
Recovery is a great question, and I don't think is a question we actually thought of to start to provide for nursing homes. So that is a question I will take back to the officials higher up than me to figure out if that's something we can do. For deaths, the governor announced that we will now collect that information by county level. And we will start collecting that information, and that information will show on our database starting next Wednesday.
But for thousands of families like Natalie's, these delays only cause more worry about their loved ones.
That she'll pass and we won't be able to have any heads up, and we won't be able to do anything to be able to, give her a hug or just say I love you on the phone.
All right, now if you have a loved one in a nursing home, that website by the state is now up and running, and they did just update it today. That is available at WKYC.com. I do want to note, though, these are just current cases, not all cases, as we've been continually requesting. Rachel Polansky, 3 News.
Rachel, thank you so much for continuing on this. I know there's thousands of families who are literally every story they are getting that information, and it is so important. So we'll continue to keep an eye on things, I'm sure. All right.
Of course.